office, and they're going to present on a Native American COVID-19 campaign that they developed with IAD.
Hello, everybody. Hope everybody had a good lunch, but is awake right now. I know I was kind of getting a little bit sleepy, waiting. But luckily, my son's in school now, so I had to deal with his getting him set up for his classes. So we'll go ahead and start the slides. Basically, this is an overview of our Native American media campaigns. Are you controlling the slides, or do I have control over them? Hello?
I'm sorry, Jay, I'm on mute. I was talking away. Sorry about that. I'm trying to get controls of this.
I know, I was trying to.
Are we supposed to start at 1 or 1:15, guys?
At 1.
Yes, sir.
We're
Please
going to
remember to mute your
Lori.
phones.
Okay, Jay, I try. So this, I want to talk a little bit. Thank you. This campaign was a great sequel from the Native American opioid media campaign, A Dose of Reality About Opioids. We commissioned Ricardo Cate of Santo Domingo Pueblo to develop 7 cartoons. And it was to discuss the precautions to prevent the spread of the coronavirus and protect New Mexico Native American populations. And what we were seeing was Native Americans make up 11% of the total New Mexico population, but represent, at the time, our data was showing 60% of all COVID-19 cases, and that has recently decreased. And I'm thinking it's because of other areas increasing. And so I believe we're around 32%, but and even at that, that's still very high for the Native American population being 11% of all of New Mexico. So it's very shocking. And this campaign stemmed off of wanting to find out what we can do to get the message out there to our tribal communities. And it seems to be pretty accepting. Everybody really likes the campaign, and not only within tribal communities across New Mexico. So that, to me, I appreciate that everybody is liking the campaign. See if I can move. So this is one of our flyers. This is the cartoons that that Ricardo has developed, and we worked quite a bit of hours to develop this campaign and create messages that were very simple and to the point. But not only that, there's also a component of making sure that it's culturally appropriate, in the sense of tribal communities want to come together when things are awry. And so we talked about how can we do that when we have to practice social distance, and how can we make sure we're following the state and tribal guidelines, but still holding on to our traditions. And so it had us really think about the things that communities can do to do that. And so one of the corner pictures talks about remembering our traditions and practicing their language and prayer. That's something you can do as an individual by yourself, as a family by yourself. And so it was really challenging to think about the things that we can do when we're not able to all come together during like feast days, or you know, our dances, or just different things. And so we wanted to make sure to incorporate some of those things they can still do. and this can be found on the Dose of Reality website. So I want to share real quick these two quotes from two very important people, two very important individuals that came together during this campaign. And so Secretary of New Mexico Indian Affairs Department, Lynn Trujillo, when I think as soon as COVID hit, she talked about how we need to come together. And so to me, it really focuses on the outcome, that we need each other to make it through this. And that was a huge message, I think, for not only tribal communities, but all of New Mexico, all of across the nation. Like, how do we begin to work on this? And I think we need to also understand that if we do this together, we'll all get, we'll make it through together. Ricardo, I love how he mentioned that, laughter is an important part of being Indian. And I definitely agree with his statement. And I think it reminds us that Native humor is what keeps us strong. Humor plays a valuable impression within this campaign. That some people may wonder, why are we using humor? But us to tribal communities, humor is what balances us with that reality we have to face. And so it was really important for us to be able to use that in a way that we know that we're talking about something serious at the same time, even though we have that humor part of it. So, next is the video, and so Jay, you can mention anything while I bring up the video. I don't know if I'm missing any of the chat too. So let me.
Hi, like Tona had mentioned, this campaign we kind of developed basically with the idea or the goal that we would be able to share our precautionary stuff, with the communities, and in a way that they would be able to understand. But go ahead and play the video, Tone.
Thank you.
Students, New Mexico Native people, community and culture. Remember to stay home and distant from others. Wash your hands. Wear a face mask. Clean frequently touched objects. Continue praying and using your traditional language. And listen to the instructions of our tribal leaders. We will persevere. Hashtag Students in Mexico. For more information, visit doseofreality.com. Mexico Human Services Department.
So the video can be found on the Dose of Reality website. I encourage all of you to share it, check it out, post it. Let me bring up the PowerPoint again. So wanted to be able to share with you some of the numbers. So here are some of the numbers within the first 2 hours of the post on your right that was sent out. And one of the things that you can read about it, what we were able to do, how much the paid boost was around $85.83. And we were surprised at the numbers. We were very surprised and very happy that it was a huge outreach. We created the Dose of Reality tribal, design on the right. It was, if Jay can kind of talk about that a little bit and share how that came about, because I think it's important to recognize the different symbols that were impressed in this campaign. And then if you want to talk a little bit about the coloring book.
Yeah, so the logo we have here, A Dose of Reality, we were really hoping to reach the Native population as far as something that's relatable to the communities, because with the tribal outreach work I was doing, I was seeing a large need for more education, just to build the capacity, the readiness levels to deal with a lot of these issues like the opioid overdoses and opioid use disorders on reservations. I think was largely overlooked or not reported on as much as it should have been. So I think really what we're hoping to do, what our goal was to, design a logo as well as, resource information and materials that is specific to our Native communities here in the state. And, basically across the board, with all tribes, the symbolism in this logo, references many things to all of us in different ways, not straying from the fact that it is a powerful symbol for us, the medicine wheel, the eagle feathers, and the 4 colors, depending on how you use them. These 4 colors are significant in all of our tribal nations. So with this design of this new logo, that's what we were hoping to do, was to be able to have something that the Native population could read or reference or could, really take to, so that's where the logo came from, or the design of that logo.
Thank you, Jay. So one of the last things I want to leave you with is campaign message was basically, we are one. Please be respectful of all community members, whether they are COVID-19 positive, are getting tested, are wearing masks, or their family is in quarantine. Respect one another. It's not our way to single someone out. We will persevere if we protect our community, families, and ourselves. Hashtag Students New Mexico. And not only did
the color,
huh?
I forgot the color.
Yes, that's kind of what I was going to lead into. So as part of our collaboration with Indian Affairs Department, IAD, we were able to then kind of expand our outreach and have the discussion of a coloring book. And I know Jay was kind of the lead on this. It was, his idea, kind of like, hey, how can we reach the youth as well? And so there was designed a coloring book. So let me see if I can bring it up real quickly.
I think like the idea that really caught my attention, was just looking at as a coordinator, of the OSAP grant for Kiwa. We were able to work with the middle school, the elementary youth there, and just seeing how powerful that substance use abuse education, went with the kids, and really got them to open up as far as empowering them. And with that, it was in my mind that, I wanted to be able to have something for the youth, being that, just in my community, my family, that a lot of the youth do not understand what the virus is, or how it affects us, or, precautions to take, that I really wanted to, I guess, develop something or have something that they could relate to and, easily understand. So what we did with the coloring book was we were able to incorporate Ricardo's drawings in black and white so that we can give the youth in New Mexico, the tribal, any youth really, but to get them to engage with the book. Each cartoon has its own sheet, as well as the messaging that goes with that cartoon. So throughout the pages, you'll see the main cartoons that Ricardo drew with the messaging below as far as precautions to take and stuff. So, just being able to have the kids, understand the language, is a little bit more easier for the younger ages to understand. The pictures itself, really gives the youth the opportunity to, make it their own, to kind of own it in a way, to be able to feel, empowered, that they actually can do something to help, which, it really all depends on all of us as a whole. We all need to do our part. So, being able to offer that for the kids, to the kids was, we were hoping to do. And even, you know, at the end, you know, giving them an opportunity to draw a cartoon of their own, and, you know, with its own messaging or however they felt, you know, or even the cartoons that were provided, you know, that we would ask that they would share their artwork with us at hashtag Students New Mexico or our A Dose of Reality website. But, you know, I was hoping to get as much youth engaged and to reach as much of our Native population as possible. So with IED heading up the distribution, we also have this coloring book as well as other materials at doseofreality.com or A Dose of Reality, our website. You know, they're available to download and print as you need. You know, everything that I've been seeing about this coloring book has been all positive, and, you know, we're hoping to be able to get, you know, I think it was 200 per tribal community out, but I'll go ahead and let them.
Yeah, thank you so much, Jay. And I know there's so much we can talk about the coloring book, and so we will answer any further questions during the break or as the time goes. So we don't want to take any more time away from the next presenter. So thank you so much, and we'll answer chat.
Thanks, Tone and Jay. I know there were a couple questions in the chat, so that would be great if you could provide some answers to folks.
Yeah.
The second provider highlight this year is the PFS 2015 grant cohort, and they've prepared a video of their programmatic successes over the course of the last 5 years, and then they'll take some questions at the end. So.
Is there supposed to be sound?
The sound is coming up. This is the introduction.
Okay. There's no sound, or I'm not getting sound.
Tone, I see you shaking your head. Are you not able to hear the sound?
I can't hear it. Are everybody hearing it? I can't hear it.
Let me try one
There's
more
no
time.
sound.
Yeah, I can't hear it either.
Okay. I'm gonna start from the beginning. There's no sound in the beginning.
Hi, we are the University of New Mexico Campus Office of Substance Abuse Prevention, established in 1992 under the Center of Alcoholism, Substance Abuse, and Addictions. Our vision has been to create a thriving campus community free from the negative consequences of alcohol and other drugs. Our team has changed over the 5 years of the grant, with our most current staff being the most stable and, must I add, the most successful of them all. Because we oversee the Drug-Free Schools and Communities Act, we've been able to change policy every year and added changes such as making UNM a tobacco-free campus, requiring students to lock up their prescription medication, and implementing a 3-drink limit at our campus tap room. Our prescription safety program has been very successful through collaboration with our research centers and our student pharmacy. Here you see some of our media materials through the prescription safety program. On our left, we have pharmacy bags that our student pharmacy has been given to students. In the center, you see a Snapchat filter that we provided during National Take Back Day. And on our right, we see a lockbox that we provided to students that have been really well received because they are very discreet and very safe for students to keep within their dormitories. Our law enforcement partnership has been very successful with University of New Mexico Police Department and our New Mexico Special Investigation Unit. Together, we have rebranded safety for students to show them that we care and that we want them to be successful in their academic experience. Here are some examples of our media materials for our law enforcement partnership. On the bottom right corner, you see a meme of those of you that know Dwight from The Office, of us trying to meet students where they are when it comes to pop culture. Our under-drinking media campaigns have been really successful, especially through the use of fourth-degree felony. Many students are not aware of the consequences that can affect their academic status as well as their career goals. In partnership with our Higher Education Consortium, we've collected data through the Student Lifestyle Survey to get a closer look at our students. This is separate from the New Mexico Community Survey. Some of our biggest accomplishments throughout our 5 years has been using drug detecting posters that created a lot of conversations about the dangers of mixing alcohol and drugs. Our Fun in the 505 booklet has been very helpful for students to find activities around Albuquerque that are not requiring any use of substances. We help establish a UNM Collegiate Recovery Center for students in recovery or seeking help for an addiction. We would like to thank our New Mexico Higher Education Prevention Consortium. We've really enjoyed working with you. And we would like to thank our partners at the counties throughout New Mexico within the PFS 15 grant. It has been an honor and privilege to work alongside you all. Thank you so much.
Hello, everybody. My name is Tony Johnson. I am the Prevention Program Coordinator here at the Institute of American Indian Arts in Santa Fe, New Mexico. We're really excited to be presenting some information about our awesome program here. So here at IAIA, our prevention program is under the Student Life Department. Our program director is Paul Moore, our interim dean of students. Myself, again, Tony Johnson, the program coordinator, and then we have Ruth Sempian, who is our program assistant. The name of our campus-based coalition is the American Indian Prevention Association, APA for short. We had subcommittees. We had a student life subcommittee. We also had an Indigenous Queer Two-Spirit Plus committee under our awesome coalition. And our vision was promoting the mental, physical, emotional, and spiritual well-being of our intertribal community members, while increasing cultural competency and creating community-based solutions. So one of the main missions of APA is to continue bringing about positive changes in lifestyle, relationships, and education for the overall wellness of our IAI community members by creating multi-level cultural-based prevention strategies. Areas of focus was focusing on alcohol misuse, prescription drug misuse, as well as ATOD policy review, suicide prevention, which is one of our tribal track strategies, along with our student peer mentoring program, which is also a tribal track strategy. Over the last 2 years here at IAIA, we have been moving through the strategic prevention framework. We jumped into this grant in the 3rd year. So in the last 2 years, we have been doing our assessment, building some capacity, and we just started implementation this past summer. And again, one big part we are very proud of was implementing some prevention strategies that we hope will strengthen the community circle and in the process of preparing our tribal college community for the future.
So as far as some highlights go for our program, we did review and revise our alcohol and substance abuse policy and add some restorative wellness updates in there this summer. It was approved for this fall semester. Some major changes that came about were a change in the language of our 2-strike policy to a 2-offense policy and clarification and simplification of that language for our students. As well, alternatives to receiving strikes include a tribal council that would review students' cases, an advocate that the students could bring with them to share their narrative, referrals to our counseling team, a drug and alcohol screening and required counseling sessions, as well as community service hours before the student would receive any penalties. As well, medical amnesty clause, which is the same as a Samaritan law, was included as well. We believe this revised policy centers restoration and safety for our community. As well, of all of the 37 tribal colleges and universities, we are the only one at this time with a prevention program. So the very first, addressing substance use and prescription drug misuse among college age population. As well, implementation of a strategic plan has encompassed Native and Indigenous perspectives at the center while being culturally competent to tribal community challenges.
So we just wanted to say thank you for everyone that was working under the PFS 15 grants, as well as our New Mexico Higher Education Prevention Consortium group. It took us a long way to get to this point. I just definitely want to thank all of our evaluators at Higher, our OSAP managers, and Group Consulting for supporting our program and helping us build capacity and build a program that will support our tribal Indigenous community here at IEIA. So we just want to send you all many blessings from our prevention program. You can also find us on Instagram at IEIA Prevention Program. And remember, culture is prevention. Thank you so much, everybody.
Thanks, everyone.
Hello, my name is Teresa Capel. I'm the director for the New Mexico Tech Alcohol Safety Awareness Program. Christina Ward was the coordinator for the past 3 years. She grew the program to include New Mexico Tech students, staff, faculty, and administration, and the Socorro County community. She left in June to pursue a degree in law at UNM, and we're looking forward to seeing what she'll do great in the future. And today, we're going to talk about party patrols. But first, we would like to thank OSAP, Higher, and Food for all of their hard work and all of the help that they have given us over the last 4 years. In the spring of 2017, we did a New Mexico community survey, and we were also working on our strategies and figuring out what readiness was on campus. So we looked at the likelihood of police breaking up parties where teens are drinking, and it was at 6.6. So of course, this was what we chose as one of our many strategies for the PSF 15. So in the fall, we got together with all of the main players. We had campus police, state police, city police, sheriffs, Socorro County Prevention Coalition, DWI, all of the people were at the table. We set up our first party patrol for 49ers, which is our homecoming, but the city police got a call first. And so they got out there, the party got dispersed, there were no MIPs written. And so the state police didn't have a chance to get their party patrol off the ground that day. So, but that's okay. We moved forward and we reached out to the Special Investigation Unit for Socorro County, and understanding happened. All of the main players all of a sudden knew what words to be used, and things started happening. So we had a party patrol on Thanksgiving weekend, the first weekend of spring semester, and also during spring fling. So we advertised all over campus, social media, and in the student newspaper. Then in the spring of 2018, community survey came out again. This is 3 party patrols in, and barriers somewhat likely for police to break up parties, 18 to 20-year-olds, 60.2. Unbelievable. We're making a change. So in the fall of 2018, New Mexico Tech students are aware of party patrols. They're also upset with New Mexico Tech ASAP. So there were angry posters all over campus accusing us of being zealots and all kinds of other things. We're infringing on their Fourth Amendment rights. So we put together a tech talk to inform students about what was going on and what ASAP was and what party patrols were. So Johnny Chavez with the New Mexico State Police spoke about alcohol laws and the 4th degree felony and how police action for cause is not infringing on Fourth Amendment rights. And we also had our very own New Mexico Tech Dr. Frank Edscorn, who spoke about alcohol and how it affects students and their brains. And he also invented the nicotine patch. So then in the spring of 2019, New Mexico Community Survey again, 79.4 of 18 to 20-year-olds thought it was likely or very or somewhat likely for police to break up parties. We did our jobs. The people know perception of risk has increased at New Mexico Tech, and everybody on campus knows what ASAP stands for. So We're increased our awareness, readiness for prevention efforts across campus have increased, and we could not have done it without you. Thank you, and we'll have time for questions later.
Program is housed within the student engagement and campus life center at Salem College. We work closely with the student services leadership team. Funded through the OSAP PFS 15 grant. College is often a time where many college students experiment with substances for the first time. This grant allows us to provide prevention to address substance issues in the college environment. We are trying to educate not only the students, but also the college staff. The Salem College Prevention Coalition and is active with the advisory board SAFE at SJC. This advisory board includes 14 members, the Department of Safety, Title IX, Associated Students, Campus Advisory Board, KSJE Radio, Student Engagement and Campus Life, the Native American Center, Campus Resource Officer, and Public Relations and Marketing. This board has shown to be very effective in allowing us to collaborate while working towards strategy implementation and activities. Within this team, Salem College Prevention has been able to work directly with college administrative staff. Salem College Prevention Coalition and SAFE at SJC partnered with Student Life and Campus Engagement to apply for the Truth Initiative grant to build capacity towards a tobacco-free campus policy. Once awarded, college student ambassadors promoted a smoke, tobacco, and vape-free campus policy change. They held 6 events on campus with a total of 1,200 people that attended. They had 12,552 engagements on social media and 405 people sign a tobacco-free campus petition. On December 5th, 2019, college board members approved the policy change. This change occurred on January 1st, 2020. Engagement in campus life shared the 4th-degree felony of providing alcohol to a minor on campus plastic screens. We provided this messaging at movie nights, and students gave a brief PSA over the loudspeaker. We also distributed information on posters during Student Rush, Halloween Carnival, SNAP's Campus Health Forum, the annual college powwow, and during Welcome Back events. SNAP promoted the safe storage and locking up of RX painkillers at the Halloween Carnival and at Indigenous Peoples Day Health and Wellness Fair. Flyers were also distributed during the Welcome Back events for students. Medication disposal locations were displayed during family movie nights and game nights. For your time, my name is Nailita Paiuchi. I am the Social Norms and Alcohol Prevention Program Coordinator. Good afternoon. I'm Lori Vigil. I'm with Singular Substance Abuse Prevention Coalition, and today we present This is What Collaboration Looks Like in Cibola County. Multi-agency law enforcement collaboration. Law enforcement collaboration. Keeping our community safe, law enforcement and the Cibola Substance Abuse Prevention Coalition working alongside each other, distributing opioid, underage drinking, and the 4th-degree felony educational information. Thank you, Cibola County Law Enforcement. Cibola Substance Abuse Prevention Coalition, in collaboration with the City of Grants Mayor, the Cibola County Commissioners, Grants Fire and Rescue, Grants, and Cibola County Road Crews coming together to clean up the city and county and rid our streets of used syringes. National Drug Take Back Day. Over 300 pounds of prescription drugs off our streets. Thank you, law enforcement. Stop with a cop. All law enforcement agencies and the Cibola Substance Abuse Prevention Coalition coming together in feeding and providing coats, toys, and substance abuse prevention for kids and parents of Cibola County. Cibola Substance Substance Abuse Prevention Coalition members representing Cibola County at the state capitol. Cibola Substance Abuse Prevention Coalition and the Peers Against Destructive Decisions Youth Coalition educating 800 students at Grants High School on the dangers of opioids and underage drinking. Cibola Substance Abuse Prevention Coalition, Laguna and Acoma Prevention Programs, and the Laguna Police Department in collaboration to bringing substance abuse awareness to Laguna and Acoma High School students. Bernie Living and the Cibola Substance Abuse Prevention Coalition educating all Grants High School staff on the ASFS data and saving lives with Narcan. Coalition members, young and old, working together to prepare opioid awareness and deterra bag packets for distribution. Peers Against Destructive Decisions Youth Coalition in collaboration with the New Mexico National Guard at the Cibola Grants Pantry, handing out food, deterra bags, and our prescription parent handbook. Peers Against Destructive Decisions Youth Coalition, going on the airwaves of KMIN and KDSK radio to promote our program and to talk about underage drinking. Not even a pandemic can deter Cibola Substance Abuse Prevention Coalition members from educating our community and handing out prescription parent handbooks and prescription pills dissolving deterra bags. Walmart, working with us in locking up their alcohol and computer duster, keeping our kids safe. Cibola Substance Abuse Prevention Coalition encourages you to look at our page on Facebook at CSAP 87020. We have 517 followers. Thank you and have a great day.
Hi everyone, this is Ruby Garcia with Roosevelt County OSAP. Roosevelt County has been very fortunate to have been able to build and cultivate relationships that were very significant for our prevention work. Over the past 3 fiscal years, we were able to collect a total of 2,076 middle school and high school surveys. A key benchmark that we were very successful in was showing a decline in underage drinking. Over the years, the percentages of the 18 to 20-year-olds underage drinking and binge drinking was a 38.4 decrease. And actually, similarly, in the binge drinking, it decreased 66.5%. Super awesome. Perception of risk strategies and publicizing law enforcement activities strongly influenced this successful change. An example of our strong community relationship is demonstrated with our local law enforcement. We had unconditional support in all prevention activities, but the most popular prevention project was the Take Back Days. We hosted a total of 4 Take Back Days with our local law enforcement and collected over 210 pounds of old, expired, and unused medications. The prescription drug media campaign we used was A Dose of Reality, including radio ads in English and Spanish, flyers at pharmacies and health clinics, a mobile billboard, and a banner in front of the district court building. This was very useful since we publicized the most visited places within our small community. Our most recent strategy that was implemented this past fiscal year was the responsible beverage service model. Our coalition members showed a great need for this and advocated for this new strategy. We had developed an RBS model education packet and have been working with local alcohol establishments. These retailers are strongly invested in this strategy and even suggested that they want to continue receiving this support. So we have worked closely with the Roosevelt County DWI program, and they will continue with the sustainability of this project. And through all the successes and lessons learned, we are thankful to all the sectors that form part of our partnerships. And this photo is our local pharmacist, Taos Police Detective, and a coalition member, and I'm still not sure who's responsible for the lovely peace sign, but it's all fine. I hope you guys enjoy the rest of your day.
Good afternoon, and thank you for your time today. My name is Anastasia Rojas, and I am an account executive at the Key Wallworking Company. MWC is a marketing consulting firm specializing in stalled, stuck, and stale companies. We recently partnered with La Casa Community Behavioral Health to work on a youth opioid abuse prevention campaign, and like all successful campaigns, our two teams followed a strategy. This begins with research and moves through the proper processes that ultimately leads to a successful campaign. La Casa performed research assessments, and then MWC conducted local youth focus groups. First, La Casa developed an opioid core team and then reviewed data surrounding Chavez County, New Mexico, in which they found 10% of youth use painkillers to get high. Next, they identified the youth that is most at risk, students with depression, mental illness, or injuries. A large portion of the messaging that is currently in circulation does not target a specific age group and are fairly generic. The few that are targeted for teens are unfortunately not very sophisticated. We also conducted two focus groups, one with a high school football team and the other with a group from a home for youth experiencing disparities. In short, this is what we learned. Pills are bad and very addictive. There are several new slang terms for pills to include perks and lean. They're easier to get than even alcohol or weed. They're also easy to take, but you never know what's in a pill. The most interesting thing we learned was a new and very common way to get drugs these days, Snapchat. The more we heard the kids talking about Snapchat, it clicked. From this, we created the In the Snap campaign. With bright colors that are appealing to a younger audience, we created lines that demonstrate how quickly opioid usage and addiction can change a teenager's life. The headlines were crafted to reach different high school cliques and social groups, utilizing slang youths use today to get their attention. From rap battles to battling addiction, from stealing home to homeless. Snapchat geo-filters are filters you can apply to a picture you take with Snapchat. Snapchat users use these very frequently, and even if they don't choose our filter to post, they'll see our filter when scrolling through the options, enhancing our awareness efforts. These ads swipe up to our unique website, deadinasnap.com, that gives some statistics and some definition around what is considered opioid abuse. Additionally, we offer resources to learn more. The campaign has run from April to now and is overall very successful based on Snapchat standards. We are reaching our target 14 times per month for a total of 821,700 impressions. Our eCPSU is less than half of the Snapchat average. Our swipe ups are especially doing very well with a total average of 882 swipe ups for the 9 different versions. We are honored to be a part of this battle against opioid abuse and addiction in youth. Thank you for your time today, and please do not hesitate to reach out to me.
Hello, everyone. My name is Tony Henderson, and I am the OSAP Program Coordinator for Curry County in Clovis, Mexico. Successes that Curry County has accomplished has always been accompanied by many great coalition stakeholders. First stakeholder is Roden Smith Pharmacy. With our partnership, we were able to start our first take back at their location, and Walgreens eventually came on board. We've held 3 take-backs and collected a total of 245 pounds of old, expired, and unused medications. Our volunteers are from the foster grandparent and retired senior volunteer programs. We've also had participation from all 3 law enforcement agencies, City of Clovis Police, New Mexico State Police, and Curry County Sheriff's Office. We use Facebook to promote our events and to thank our community. It's not a lot, but it's a win for us when these posts are our biggest hits, and we've reached over 1,300 from these posts alone. Roden Smith Pharmacy also partners in the R4A strategy to help promote safe medication use. October is National Medicine Abuse Awareness Month, and Roden Smith was able to give out 7,500 pharmacy bags to promote a Dose of Reality campaign to our community.
Hi, I'm Mitzi Estes, Deputy Superintendent of Academic Services and Leadership for Clovis Municipal Schools. I've had the pleasure of working with the Curry County and the coalition for just over a year in this position. My predecessor was an active member of the coalition since 2016. During our partnership, we have participated in regularly scheduled meetings to stay informed about trends and needs in our area, partnered to provide free services to our students, collaborated to provide presentations, and surveyed our students to get to know our students and their needs. I sincerely appreciate this partnership and believe all students win when we work together to service their needs.
Hello, everybody. My name is Lynn Bose. I'm with Rooney Moon Broadcasting in Clovis, New Mexico. We've always enjoyed a great relationship with the coalition. Been involved with so many community events and on-air opportunities where the coalition could come in and be a part of our morning shows and allow us to get the word out about what's going on as far as prevention of alcoholism and drug addiction in the Clovis and surrounding areas. I look nothing but great things to come in the future with Rooney Moon Broadcasting and the coalition. Thanks again, and God bless.
Thank you for those great videos and for all your prevention work, the schools and the counties. We really appreciate it. I'm not seeing any questions in the chat. Does anyone have questions they want to ask now? If not, I've prepared a few that I can ask. I'll go ahead and start off with a question just to get it moving. And then if I see any questions in the chat, I will ask those to be answered. So my first question is for I know you've put a lot of work into making sure your strategies fit your community. You touched on the community activities that support health relations. Can you expand on what some of those activities look like and why they are beneficial to your specific community?
Hi, everyone. Thank you, Rachel, for the question. I think for us here at IAIA, one of the strategies that we do have is the Indigenous Peer Mentoring Program. When we first started developing this program and conducting our assessments, talking to staff, faculty, and students, one of the most common threads of conversation surrounded peer leadership. Being an Indigenous community, in order to talk about issues like alcohol use, as well as the opioid epidemic and addressing suicide, our community here really found it important to create sort of this peer networking. So not only do staff and faculty support each other, but students support each other. So again, with all of the strategies that we were approved for, that was sort of the glue that helped us move forward. And really, we wouldn't have made that awesome update, restorative wellness update to our current alcohol ATOD policy, if it wasn't for the peer leadership and ambassadorship from every staff, faculty, and student. So that's been very important. And again, it's the interconnectedness that really helped us establish our program here.
Thank you so much for sharing more information about that, Tony. And congrats on getting that mentorship program started up, even in that short amount of time. So my next question is for Cibola County. I know you did a lot of community work and public community events to support your strategies. Can you share how you were able to keep ongoing support from those partnerships and what incentivized them to participate so often?
I think what I did to begin with is like with my schools, I went and to every school board meeting and I allowed them to share their data with us, and then I shared our data with them. So that encouraged the schools to allow us to come in and work with the students. And with our law enforcement, again, I shared data with them, and we kept in close contact with every one of our law enforcement agencies. And just Cibola County, I'm sure like any other county, once you show concern for your youth, because we all have that common goal, we want to see what's best for our youth. And so once I spoke with each one of these agencies and shared some of this data, and not only that, they shared stories with me, I shared stories with them, and we all came together and said, let's do this for our community. So every time they would come up with an event, or I would come up with an event, or I'd say, let's get together, let's do this. They've come and spoke with our kids at schools. They've come to every one of our drug take back, and they kind of actually made it as a competition, you know, let's see who can collect the more prescription pills. And then also with our checkpoints, it was the same way. Prior to that, I mean, it was kind of hard at the beginning to get them to want to work together. Again, they were all in competition, but after a while, they saw that with us, I would talk about our collaboration on our radio stations, on our newspapers, about how our law enforcement works together. And I think that was kind of an incentive for them all to just say, well, you know what, let's get over this a little bit. Let's get over some of this pride. Let's do this for our community. And it really worked out. And then our youth coalition, the same thing. The kids seeing what was going on in their schools. I mean, and we would sit and talk and focus groups. We had a lot of focus groups, and we would draw in these kids because kids can talk to kids. So we got kids to be able to talk to their peers, and we kind of drew all these kids in. And before you knew it, man, we had all these kids that just wanted to share their stories and wanted to belong to something. And so they all sort of started coming together, inviting their friends to, let's do this event, let's do that event. And before you knew it, you know, our coalition, we even have a class every Wednesday at the high school. And it's not even, I shouldn't say it's a class, but it's our youth coalition. I mean, it's the day that we meet at school, and we're not allowed to go into the school, so we do everything online. So we just kind of have our youth coalition meetings there, and we have teachers that are actually facilitating that during 1 o'clock through like 1:30. So kids just come all, you know, they're allowed to zoom in and talk about whatever's going on with them and how they want to do different things for their community. So I think that it's all just, you know, everybody wants the best for the community, and especially when it comes to the youth, our future. So it was just one big collaboration after another, and everybody's just started jumping in and trying to help each other, and that was it. Basically, we just had to go in, and I just had to go in and talk to each and every one of them and show them the importance of drug prevention. So before you knew it, we had all our law enforcement, we still do today, you know, driving up over here at my house, honking outside, Lori, your dog, come and get your dog, you know, so I'll just take them outside, the box of prevention stuff, they pick it up, they're able to take it out, and whenever they do traffic stops or whatever, they hand it out. So works out pretty good.
Thank you so much for sharing more about that, Laura. That's really inspirational, and hopefully there's some ideas that people can use in their own communities.
Thank you.
I have one last question, and I think we just have a little bit of time for just this one last question. My question's for New Mexico Tech. You did a really great job with your Party Patrol program. There was a lot of success going on with that, and I appreciate you also being open about the challenges that you hit with how students saw the program. Can you tell us some more about the Tech Talks and how they helped your students understand your intentions? Was it the transparency, a different method of sharing information like a public platform, or hearing from the police themselves?
Oh, excellent question. Thank you, Rachel. I believe that the Tech Talk, there were two different things that were super beneficial from that. One was having the police officer there explaining to them the way that the law actually works and how fourth-degree felonies and access to alcohol for underage drinkers is against the law. You know, coming from people on campus, they didn't believe that it was really against the law because they're college students. They thought that they could, you know, skirt that part of the law. And then the other part was having Dr. Frank Edskorn, who is just renowned on campus, and he really connects with the students, and having him have the conversation about how alcohol affects their brains and how they're here at New Mexico Tech to be successful in life, not be successful with drinking. So they really compared tech to not being a party school, and how, their future was based on their academic success, not on their drinking success. So.
Thank you for telling us more about that, Teresa. That's really interesting to hear how you got different people together to talk to the students and explain the different laws. It sounds like that worked really well. I think that's all we have for now. Thank you all of the schools and counties for all of your hard work over these past 5 years. It's clear that there's been a lot of good change in our communities. And I will pass this back on to Coop. Thank you.
Thank you, Rachel, and all of the PFS 2015 providers. We really appreciate all your hard work over the years, and we really appreciated seeing those videos about your success. We're going to take a break, and then we're going to be back with how drinking behavior has changed during COVID-19 with the RTI folks. I just want to remind you that you don't need to log out at this time, and we'll see you in about, let's see, at 2:15.
Hi, Carolina. This is Andrea Niehaus from Coop Consulting. Hi, thank you to you and Alex for being here. I got your note in the chat and I want to make sure you're aware if you join by phone, I don't know if we'll be able to put you into panelist mode to be able to speak. If you try turning off your video, that might help save some of the bandwidth. And if the internet is still choppy, I'm going to contact our support person and see if we can move you to being able to share your audio via phone. So give me just a moment to do that.
Okay, all right. Thank you. I was calling.
This is Alex, and you asked a question about being marked confidential, these slides. It's fine. Record, right,
Okay.
Carolina? We were a little bit lazy. We took these slides from another presentation and modified them, but one of the things we didn't take out was the confidential banner because we didn't know how to do that.
Just thought we'd check. Thank you for being here. And Karen Chapman, the director of the Office of Substance Abuse Prevention, once the break is over at 2:15, she'll introduce you. So we're just waiting for our attendees to come back at that time.
Okay.
Thanks so much for doing this.
Thank you for having us. So if my internet does get bad, Alex, you can text me on Teams, and then I'll just stop talking, and Alex can take over because we have a script from a previous presentation, so we can just keep talking for me.
Great, thank you. And if you, I'm going to check with Jennifer real quick here and see if joining by phone we can get you that audio, and I'll let you know for sure in the chat.
Okay, thanks.
Followed by pound.
I think I joined as a, yeah, I did.
Hey, great, thank you.
No, I'm on both. I'm going to mute this and just use in case I need.
Okay, welcome back, everyone. And we're very pleased to introduce Carolina Barbosa and Alexander Cowell from RTI International to present upon changes to drinking behavior, both regionally and nationally during the pandemic. Please, it's all yours.
All right, can you hear me? Yes, okay, great, thank you. Let me just, all right. Hello, everyone, and we can go to the next slide, please. We are delighted to be here. We are joining this meeting to talk about the results of a survey we conducted on our alcohol drinking behavior change during the COVID-19 pandemic. This research was done by a group of 3 health economists at RTI International. We've been doing alcohol research for the past several years, and a lot of our research is related to alcohol drinking patterns. So we wanted to see if and how the current pandemic had an impact on drinking patterns in the United States. So today here we have myself, Carolina Barbosa, and also Alex Call, and Bill Dowd was the third element of the team doing this research. And next slide, please. you are most probably familiar with the prevalence of alcohol consumption and related harms in the US. So for the sake of time, I'm going to jump through the next 2 slides. So we can jump 2 slides. And perfect. And we now stop on alcohol policy and the COVID pandemic. So let's start by navigating through the many changes in policy that happened as a result of the pandemic. Next slide. And across the United States, starting in March, as we all know, a range of policy responses were implemented to limit the spread of COVID-19. Most states enacted stay-at-home orders, banned public gatherings, enacted physical distancing measures, and closed schools and non-essential business. So what about alcohol policies? Next slide. Let's first have a snapshot of the situation before the pandemic. Before the pandemic, most states sold beer and wine in food stores, and this remained the case after the pandemic because food stores were considered essential. As for liquor, most states sold it in control outlets and 20 states in food stores. Next slide. Most states that declared stay-at-home orders included liquor stores as essential businesses. And also in an attempt to stimulate the alcohol industry economy, several states provided temporary privileges for off-premises alcohol deliveries. And the map that we were seeing, that I'm sure we'll get to see again, yeah, so that map had 15 states, was showing the 15 states that relaxed off-premise restrictions by adding curbside and or delivery for off-premise sales. And I'm not sure we'll get the slides again. Is it just me that is not seeing the slides anymore? No, okay.
Carolina, I can't see them either.
I'm sorry. We can pull it up in just a second. Technical difficulty.
Okay, no problem. Well, I can keep talking. So, because I also have the slides on my side, so I know we are constrained on time. So still talking about the policies. So the slide that we had on the screen was talking about stay-at-home orders and how states relaxed curbside and other delivery restrictions for off-premise operators. And so there were 15 states that relaxed those off-premise restrictions by adding the curbside and delivery of for off-premise sales. And the slide that we're going to see next will show that prior to the pandemic, there were 28 states that permitted on-premises operators to deliver some alcoholic beverages. But to our knowledge, there were no states that permitted restaurants to offer mixed drinks to go before the pandemic. And in the slides, I had a graph showing that 24 states permitted the sales of mixed drinks to go. Anyway, the point is, and we can go to slide number 10. Perfect. Anyway, the point is that these policies keep changing. These maps are probably no longer up to date. For example, when we made that map, Michigan added cocktails to go. And also, even though these changes were said to be temporary, they might be here to stay. For example, in late June, Iowa became the first to make cocktails to go permanent. A lot of these policies are in the EPI's website. And if you go to the EPI's website, there's a special coverage on COVID-19. I was actually checking it this morning, and the change in Iowa is not there yet. So it's not the most up to date, but at least until the first week of June, it should be up to date on the website. Anyway, next slide. So what do we know about alcohol consumption in the midst of the current pandemic? And now, next slide is going to show a bunch of media reports talking about sales data. So off-premise alcohol beverage sales increased considerably since the stay-at-home orders and the relaxing of alcohol restrictions, but the spike has been uneven. And the increase in off-premise sales might not have been enough to offset the fact that practically every business that serves alcohol to drink on site was closed for 3 months. And there are also reports that consumers are spending less on alcohol because of transferring purchases from on-premise to off-premise. And also there's reports that people are buying cheaper. So overall, the big picture is there's a big ambiguity with regards to the overall effect of sales changes on consumption. Because are people stockpiling? Are people increasing immediate consumption? And has the way people drink changed at all? So next slide. What do we know about alcohol consumption? Several messages exploded across the media stating increases in alcohol consumption related to increases in sales and justifying this with the social isolation, stress, changing work patterns, and overall economic turmoil. These increases have also been hypothesized based on the impacts of previous disasters on alcohol consumption. We know that after the terrorist attacks of September 11 and also Hurricane Katrina, there were sustained increases in alcohol consumption and also increases in the prevalence of alcohol use disorders, binge drinking, and alcohol attributable violence and deaths. Still, the weeks of isolation imposed by stay-at-home policies and the scale of the current pandemic are unmatched by these recent disasters. So I ask again, has overall consumption really increased? And if so, did it change more in some groups than others? Can some people be drinking more and in more dangerous patterns? And this takes us to the RTI survey. Next slide. Given this proliferation of anecdotal data on increased drinking and the evidence of an increase in off-premise alcohol sales, we realized that the best way of filling the gap in knowledge in drinking patterns was to do a survey and to do one really fast. Over the next slides, I'm going to talk about the survey, how we analyze the data. Our survey was motivated by 3 fundamental questions. First, given what we know about the policy changes, the stay-at-home orders, the changes to alcohol restrictions, how did overall consumption change? Second, we know that the effect of alcohol on health depends on how much you drink and how often. So it's not just overall consumption that matters, but also drinking patterns. So we're looking into drinking patterns in the survey. And third, we also know that drinking and related harms vary by socioeconomic groups and other characteristics. So we also look at changes in patterns by several factors, such as gender, race, ethnicity, kids in a household, employment, mental health, etc. And here's a bit, next slide, of background on the survey. We work with Ipsos to administer the survey. Ipsos has a standing panel, it's called the Knowledge Panel, of more than 55,000 adults who respond to survey questions. And this panel was recruited through a address-based probability sampling methodology. So the key point is that this is a national representative sample of the United States. And respondents filled the survey in the second week of May. The survey had several questions, and with regards to alcohol, because consumption questions ask about drinks, the survey first defined what a standard drink is, and the next slide will show you the picture that we had in the survey. Most of you probably know what is a standard drink. It has 14 grams of alcohol. The next survey is going to, the next slide is going to show you the main questions related to, not the actual questions, but what we capture in the alcohol consumption questions. It is very important for you to pay attention to this slide because it lays out the different dimensions of drinking that you are going to see again when Alex talks about the results. So the first two, the frequency of drinking and the usual quantity, are the bedrock of assessing alcohol consumption. And then the next two dimensions account for alcohol consumption on days when people drink more than they usually do. And we use these first 4 measures to calculate average drinks per day and the last measure to assess binge drinking. And the next slide will show you that we also collected that information in the survey, so related to mental health, employment status, and alcohol-related experiences. And now I'm going to turn it over to Alex to talk more about the survey and survey results. And I'll come back to wrap up our discussion.
Thanks, Carolina. Hey, everybody. Hey, I'm gonna pause for a second. I'm actually looking at the chat here, and there's 2 questions. One is, can you repeat the website? I think it was the APIS website that people wanted. But second, which I can answer, which is, who is RTI? What are we doing here? I see a whole stream of that. So RTI is originally Research Triangle International, Research Triangle Institute. They became international, so they used just the acronym RTI. Our website is indeed, thank you, Heather, www.rti.org. We are mission driven. So our mission is to really improve the human condition, and that's the kind of work that we like to do. We are private but non-profit, and so we rely on grants and contracts. We're not a university. We don't get an endowment of any kind. So I hope that answered that one. And Carolina, I think it was the APIS website, which I believe is up at NIAAA.
Right.
Is that right?
Yes, I can put the link. I know I'm looking at the chat. This is very, I was focused on taking you through the slides, and I see, Alex, you were not listening what I was saying.
But no.
Well, you are reading the chat, but I can put the link to the APIS website.
Somebody just did that. Somebody just did that.
I see a question that might be relevant. We can answer now that we are on break, related to how was the sample selected. So this is a nationally representative sample, so it's probability based, and Ipsos did that. So we used their standing panel, and basically they selected 1,000 people using very complex survey weights that make sure that the sample selected is nationally representative. So we use the survey weights in all our analysis.
In fact, if you go to the very next slide, please, you'll see more on that very question. So I'm going to start my bit of the spiel, if you don't mind, guys. So Caroline just mentioned the nearly 1,000 surveyed. We're going to focus on the 555 who reported drinking in February. We're interested to see how the drinking patterns change. That's why we focus on them. And that 55% people drinking is about the same proportion of current drinkers found in the NISDA, National Survey on Drug Use and Health, which happens to be fielded by RTI. If you were to spend some time on this slide, you see that the kind of balance that we get in terms of the gender balance, age, race, ethnicity, is pretty much what you get with census, as is the breakout by region. So let's go to the next slide. I'll just tell you a little bit about who we compared and how. So we compared drinking in February to drinking in April. We used some regression methods to adjust for things like gender, age, race, and other factors, but nothing too fancy. It was pretty much straight up estimates that we used. And we really wanted to think about, well, did alcohol consumption change, and what dimension of alcohol consumption changed over time? What changed the most? Was it the quantity being drunk at a time, or was it the frequency, the number of days in a week being drunk? Let's go to the next slide, and then quickly go to the slide after that. So we looked at three main outcomes in this presentation. Let me just briefly describe those. The first one is average drinks per day. That's pretty straightforward. The second one and the third one are really to do with people's health. And the second one is the proportion of people who exceeded drinking guidelines. And for those, we use the US government guidelines that many of you, but not all, might be familiar with. That's 4 or more drinks per day for men, or 14 a week for men, aged 18 to 64. And we also looked at, and for women, it's 3 drinks a day, and more than 3 drinks per day, and 7 per week for women, and for men aged 65 or older. And then that third measure, which is binge drinking, refers to drinking 5 or more drinks in a 2-hour period for men, and 4 or more drinks in a 2-hour period for women. Let's go to the next slide, please. So the results, the big drum roll. So one of the main takeaway results is that there was a 27% increase in average drinks per day, just going from February to April. So that seemed like a pretty big number to us. When we drilled down into that, we found that that most of those people, 41%, drank more on a daily basis in April compared to 30% who drank the same amount in February and April, and 29% who drank less in April. So one of the key takeaways here is we saw an increase in average drinks per day, and it's because people had, and that spoke to about 41% of the people. Another way of looking at that change over time is thinking about it in terms of drinks per week. So the average person who increased their drinking drank more than 5 extra drinks each week. That's quite a lot. And another thing to note is in the April estimates, we included people who didn't drink at all, which is about 10% of those who drank in February. So if we excluded those people, it'd be even higher. Now, the other heads up on this before I move on is that 41% of the sample who actually increased their drinking. We're going to come back to that in 6 slides time. So don't be surprised if you hear me talking about that 41% of the sample who drink more. Let's go to the next slide, please. And in this slide, we're going to move from drinks per day to talking about exceeding guidelines. So this is just exceeding guidelines. This may not be healthy, but it's not binge drinking. We found a large statistically significant increase in the proportion of respondents exceeding guidelines. Remember, that's 4 drinks a day / 14 a week for men, 3 drinks a day / 7 a week for women. So we found a 21% increase in that, I think it's 29% increase in the percent of people who exceeded these guidelines. Sorry, 21%, I misread. 21% increase in the percent of people who exceeded these guidelines. Let's move to the next slide, which is binge drinking. And the percent who increased binge drinking from February to April is also large, 26%. So for days per drink, we found 27. For the last slide, we saw 21, which was harmful drinking. And here, binge drinking, 26%. So we're seeing about increases of about 25% increase in drinking across all these different measures over a relatively short period of time. Let's move to the next slide. In the next slide, we're going to be looking at stratified results. In other words, when we break the data up, what does it look like? And these are really important. We know across all respondents that drinks per day, drinking in excess of recommended guidelines, blah, 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 all went up. But how did they change and who did they change for? So I'm going to select a few highlights as well as specific dimensions of drinking behavior that are behind the overall increase we observed. Let's go to the next slide, which is for people with children in the household. Again, we're sort of picking and choosing because we're kind of time limited here. And this one is looking at average drinks per day among households with kids versus households without kids. And the big takeaway here is that respondents with kids reported an increase in drinks per day that was more than 4 times as large on average than the subgroup without kids. And that was statistically significant, 4 times as large, folks. Let's go to the next slide where we're going to be looking at a map. Now, one of the drawbacks of having a sample of one of the great things is we had a nationally representative sample. One of the drawbacks is given limited resources, we had 1,000 people responding, 555 drank. We could not break it down by state, but we could do it by region. So this is what it looks like. And what you find is that even though you have roughly equal numbers of respondents in each region, the drinks per day increase was the most in the West, the region that includes you guys in New Mexico, where the average respondent drank about 0.35 more drinks per day. 0.35 doesn't sound like much, but if you roll it all up, it's a bit more than that. It's about 10 drinks over the course of a month. And this difference between, say, the West over on the left there and the Northeast over on the right was statistically significant. So those differences over time were statistically significant when you compare the region with the most to the region with the little. Okay, so when you go to the next slide, it's going to be a bit of an eye chart. Bear with me. We're gonna get through this one, guys. So this is a tree map. And we're going to stratify respondents based on which of the 3 dimensions of drinking they increased. So these dimensions are frequency, quantity when you drink, and then the maximum amount that you drink. When you look at this diagram over on the left, those left 2, the dark blue and the dark purple, drinks per day decreased, drinks per day unchanged, those are people who either decreased drinking or drinking didn't change. Let's move to the right. Over on the right, we see lots of little different boxes that break all those, break the group of people who did increase their drinking into the different bits and pieces. And the color of the segment represents the average change in drinks per day within that group. The size of the segment represents how many people are in that group. So what's the takeaway? It suggests that the groups that really drive things, if you look over to the right, there's a little red blob in the middle. There's a group that increased their frequency, that increased their quantity, and increased their maximum drinking over time. They are driving much of this change over time in the average drinks per day. Excuse me, tripping over my own tongue. So if we go to the next slide, here's the takeaway in words. What we found is that 5% of the respondents increased the alcohol consumption from February to April in each of those 3 main dimensions. It was that red blob. They drank more every day, they drank more on the days of the week, and they increased consumption on days when they drank more than normal. And what's really important about this group is they account for over 40% of the increase in alcohol consumption for all respondents. I hate to just read a whole slide out to you, but this is worth it. This is a very important slide. So if you were to take away, say, 3 slides in this presentation, in my view, this is one of them. So let's go to the next slide where we get more into excessive consumption behavior. So far, all I've talked about is just drinks per day. And I'm going to move to the next one in the interest of time. I'm going to talk about women. And so what we found when we looked at both binge drinking and we looked at drinking above guidelines is that the increase in excessive drinking among women exceeded that for men. So pause for a second and realize that among our respondents, women were quite a bit less likely than men to drink in excess of recommended guidelines in February. So back in February, they were much less likely than men to drink in excess of recommended guidelines. In April, that flips. In April, women were more likely than men to drink in excess of guidelines. And we found those differences between the genders to be statistically significant. We also found the next slide really interesting, which is race and ethnicity. The big takeaway when we looked at race and ethnicity when it comes to excessive consumption behavior was that the increases among respondents who self-identified as Black were much larger than those for people who self-identified as white. Again, when we look at excess of recommended guidelines, so this is, probably borderline healthy, not healthy, the percentage of respondents reporting drinking in excess of recommended guidelines increased nearly 6 times more for Black respondents than white respondents. It's quite a difference, isn't it? If you go to the next slide, which showed kids, it reinforces the prior slide that we had. We saw that excessive consumption increased more for respondents who had kids in their household. We didn't find this one to be significant, statistically significant. What we did find was a prior slide that demonstrated the differences among average drinks per day. So let's go to the next slide, which is another map. And this map looks just like the prior map in that what we saw again was that when you look at the regions and the variation across census regions, and this is for exceeding guidelines, we found that the West was worst in terms of exceeding guidelines than the other 3 regions. Likewise, if you look at binge drinking, which is the next slide, I'm so used to There I am clicking on my thingy, expecting it to move forward. The next slide was binge drinking. And that also was found for the West region. So again, the increase was largest in the West and lowest in the Northeast. I can't leave you without doing another tree map. And here it is. So remember, the tree map is showing groups of people. We're taking that drinking and we're breaking into groups of people. And we're looking at how much drinking goes up within those groups of people. That's what a tree map does for you. So it's not just a big nerd out, there is actually some purpose to this. Over on the left of this tree map, if you can see your screen well enough, you can see 3 boxes that say, all have something to do with exceeding guidelines in February. Over on right, there are 3 stacked boxes. One of them is bright red, and we'll talk about that in a minute, that are to do with exceeding the weekly guidelines that did not exceed the weekly, did not exceed weekly guidelines in February. Okay, so on the left is exceeded in February, on the right is did not exceed. So what we're seeing here is that there's a relatively small group that's bright red, where those guys were the ones that exceeded their guidelines by a large amount in April. And what we're finding, the key takeaway, is that the biggest increases in alcohol consumption were concentrated among respondents who reported new initiation of excessive drinking. So the takeaway from this tree map, folks, is we found when we drilled into the data that the people who are really driving the excessive drinking weren't excessively drinking in February. So that, to me, was quite jarring to see that. The final slide is also a bit of a nerd out before I turn things back to Carolina. So we'll go to that one. So we've seen 2 tree maps. We know that there's a whole bunch of people who started excessively drinking in April that weren't drinking in February. Did they also overlap that group that was driving things in the prior tree map? And the answer is yes, there's a lot of overlap. So what this slide is trying to say with a fancy map and lots of numbers is that taken together, the 2 segments, those 2 red boxes, are only 7% of all respondents, but they account for 65% of the increase in drinks per day. So again, we also found in large part a small group of people who are not drinking more than recommended guidelines in February increase their consumption considerably. And I think from a prevention standpoint, this really has a message. And to me, what I think about is there are healthcare professionals out there, not necessarily prevention specialists, but healthcare professionals, the doctors, the dentists, who are seeing patients on a regular basis. I think there's a real opportunity here to screen them, but not just screen them again. Because remember what we found a lot of this excessive drinking increase was in people who had not been excessively drinking in February. So I see a lot of chat going on, but I can't talk and chew gum. I can't walk and chew gum, let alone talk and read chat. So I'll turn it over to Carolina to wrap things up. Oh, Carolina, you're muted. There's some hand signals going on.
I think am I unmuted now?
Yeah, we can hear you.
I can hear me twice. All right, so let me get out of the phone, and why don't you show slide 45 again while I switch technology, please. Slide 45 will show the Hispanic rates versus whites.
We did find an increase. What I can't recall is whether it was bigger than, say, white. statistically speaking, but it was certainly bigger than white.
Right. So, I mean, you can see here, you know, that back in February, whites were consuming more than Hispanic, but then in March, the increase is not just larger for Hispanic than white, but they're also exceeding the consumption, the white consumption. I can't remember if it was statistically significant. If it was, we would have said so. So maybe it just did not reach significance. All right, so should we go now that I'm back on
I interject with something. I noticed somebody, you know, was talking about people who self-identified as Black being tied to COVID. One thing we couldn't really pick apart, but we hoped to, but we couldn't really, was, you know, was this because, or really associated with changes in alcohol policies that states were putting in place, or because of the shutdown or COVID? You just couldn't statistically really separate those out. I saw that in the chat. Sorry, Carolina, back to you.
And in terms of rates that we're not reporting here, we can always look. I don't have them on hand. I have a few other things, but like I see some of the questions in terms of rates for Native Americans. We can definitely look at the data and report that, just not right now. Okay, so let's just conclude this and then we will take more questions again. And the key takeaways. So the next slide. Okay, here are the key takeaways. Thank you so much, Alex. There were a lot of interesting results, and I'm going to try to summarize with a few words or key points. And also, we're going to think about the implications of these findings for public health and policy. So we find that after the enactment of stay-at-home orders in many states and the relaxation of several state alcohol regulations, key point is alcohol consumption, including drinking above guidelines and binge drinking, increased overall and for all groups assessed. We also saw that almost half of the population who were current drinkers in February increased drinks per day, with 31% of those increasing frequency. And again, we found that women, Black people, and people with children experienced the largest increases. And we also saw large increases in consumption among those that were not drinking in excess of recommended guidelines in February. And this is really important because this is not people who always drank a lot, suddenly drinking more. This is people who drank within the guidelines, drinking a lot more. And so now let's brainstorm, why did alcohol consumption increase? So next slide, what can explain the increase in alcohol consumption? Some studies predicted lower alcohol consumption during COVID, and this would actually make sense because of restrictions in place and the closure of on-premises. And most studies that predicted that lower consumption justify this with the financial constraints and also the lower access to alcohol. But looking at those studies, we have to think that there's a lot of international variation in the response on how to address alcohol use during COVID. For example, some countries such as South Africa and Thailand, they ban alcohol sales completely. Whereas governments in North America, Australia, and most of Europe deemed liquor retailers as essential services. So next slide. Why did alcohol consumption increase? Is it possible that the relaxation in alcohol policies with off-premises being considered essential business and the privileges for alcohol deliveries, curbside pickup, and mixed drinks to go offset the general lower access to alcohol? Next slide. And together with the enabled access, the media also reported how more leisure time, unemployment, and different working arrangements might have contributed to an increase in consumption. And finally, next slide highlights a response to stress. Increased consumption might be a response to stress. And here we really need to account for increases in excessive consumption, and particularly the findings of a greater increase in drinking above the guidelines for women than for men. Research already shows that women are more likely to use alcohol to cope with stress, depression, and anxiety. And all these are human responses to the pandemic. So next slide. What are the implications of this increased consumption? There are short and long-term consequences. In the short term, the impact of increased consumption on accidents and injuries might actually go both ways. On one and driving decreases with higher restrictions, but that does not mean that drink driving decreases proportionally. And if enforcement decreases, the relative risk of alcohol in crashes might actually increase. Also, we need to think of the impact of shifting from on-premise to off-premise consumption. It might actually increase harms of alcohol consumption at home, which has been associated with domestic violence and child neglect. And finally, since alcohol consumption can weaken our immune systems over time, any persons with problematic drinking behaviors can be those that are most vulnerable populations to COVID-19 because of the increased susceptibility to lung injury. And the long-term effects of the pandemic on alcohol use and related harms are another consideration, because normalizing the home drinking and reinforcing drinking to cope with stress, anxiety, and boredom might escalate into an alcohol use disorder. And as I already mentioned, there's evidence from previous studies of the impacts of pandemics and natural disasters that show that the long-term increases in alcohol consumption and related problems are a fact. And of course, we have to think about the morbidity associated with alcohol consumption. Thinking, for example, of alcohol-related injury, and the higher increase in drinking above guidelines for women is concerning. I know, I really like emphasizing the results for women. But the reality is that women are more susceptible than men to the effects of alcohol-related liver injury. And if we look at the trend for the past 2 decades, it already shows how alcohol consumption and problems have increased more among women. So this is a concern. With the exacerbation of these trends, with the current pandemic, we really need to be aware of specific groups, and women is one of them. So next slide, what's next? What are research priorities? These results overall show the importance of monitoring alcohol consumption and policies now, and as restrictions are being lifted. One question is whether alcohol consumption will return to pre-COVID levels. Another big question is whether the relaxed rules on alcohol sales can become permanent after the pandemic, which we already see that it's happening. Because these measures were implemented to minimize physical contact, to reduce COVID transmission, but they were also made to support businesses by introducing new ways for the public to access alcohol. So if these measures are not reversed, they have the potential to increase population level alcohol consumption, and of course, all the related harms for the long term. It's also important to monitor alcohol attributable harms during and after the COVID crisis, because if we understand these harms, it can lead us into understanding and optimizing interventions, and also improve disaster preparedness and responses in the future. And very important is to remind the public of alcohol drinking guidelines and the recommended limits on the quantity and frequency. And also think about public awareness campaigns that encourage people to drink less, or at least not to drink more than they were drinking. And finally, there's also a big need to understand the actual connection between these policy changes and alcohol consumption. The variations in policies controlling this alcohol access and that's happening, it's creating an ideal environment to conduct natural experimental studies, so we can compare the different levels of public access to alcohol and alcohol-related outcomes. And so you want to understand that, we can think of the implications of shifting the level of public access to alcohol in a crisis. And with that in mind, one of our immediate next steps at RTI is to try to conduct further waves of this survey, to do this research. Okay, I think we're done. Final slide, and now we can think about more questions. Thank you for listening. So are we going to be reading the chat?
Does anyone have questions for our presenters? They talked about a lot of really great data and a lot of very interesting results.
Maybe we burn them out after a long day.
This is Tone. I really enjoyed the presentation, but it also reminded me of this other webinar that I attended recently in regards to the deliveries that are happening to homes, or you mentioned, I think it was at Cocktail on the Go or something like that. So I attended a presentation, and so it mentioned a lot of the taxes that weren't necessarily going back to the communities to then incorporate those services that were needed to provide for, whether it was to treatment or prevention or even to law enforcement. And so it was interesting to also hear about how these, not only that, because I was kind of like, well, can't we increase the tax? I'm automatically like, well, let's increase the tax or how are folks getting around it? And they are finding ways to get around delivering alcohol to homes in a way that defeats the purpose of being able to be in compliance with the law. And not only that, not only in compliance with the law, but just being able to provide that alcohol to the consumer. And so it even just that presentation was worrisome. And now you're kind of telling me, hitting the nail on the head with additional data points around this really happening. And I also think there's information being spread about how the pandemic is creating folks to have a status of being in a grief mode, and when I think of grief, I'm like, that's sadness, that's worrisome, that's all these different emotions that folks are feeling. And when you show the West, I'm kind of like, we're already full of trauma, and probably really high ACE scores in the West is my assumption. And so I'm already kind of like, there's so much in play in that area. And so it's really it makes me think a lot more. And one of the things you addressed was considering publicizing to communities about monitoring their alcohol intake. And I think that's kind of not necessarily a strategy that or media campaign that is done, but we do emphasize on providing alcohol to minors, which is a 4th-degree felony, and in collaboration with law enforcement. And I think there's a lot of chat and questions happening in the chat box. I want to stop there, but it really had me thinking. And so I appreciate your presentation, and I'll let you guys look at the chat and answer questions. So thank you.
Thank you, Tone. Tone, what was the webinar that you attended? I'm really interested in that. I don't know if you have the.
Let me find the title real quick, and I'll.
Thank you.
I attended as well. I was recently 2 or 3 or 4 days, or I'm lost in time. But it's one of those with the NABCA and back.
This was the National Law Enforcement, or National Liquor Law Enforcement Association training on, well, more like a webinar around liquor laws and regulation. And the 2 main states were Virginia and
Massachusetts.
Yeah, I think it was Massachusetts. Yeah.
I'm reading
But
it.
it was very interesting how they talked about the direct shipping, how the retailers are getting around it, how just different groups, how they're not working with the law currently, because and not only that, some of the law enforcement agencies, they are making kind of bending the rules a little bit, or allowing some things to happen, so then they can regulate it. Then they're able to say, okay, if we're going to allow this, then you have to abide by these rules. You have to register, you have to limit the number of things that you're doing. There's different components that they included, but they do talk about the deficiency that law enforcement agencies do not have enough manpower to be able to make sure people are in compliance. They talk about UPS delivering to the home, and how are they going to do compliance checks, that they're checking IDs, that they're checking that it's somebody of age that is receiving the package. So they're thinking about those things, but not necessarily having the manpower or ability to have an impact on making sure that those things aren't happening. Some of them have included packaging stickers that, this is alcohol, this is liquor, just different things. But I think it was really interesting and something to consider. But I know even in New Mexico, I think the only thing that we're allowing or that is allowed is wine delivery, if I'm not mistaken. And that was the only thing. We don't do beer, spirits, and I think that was pretty much it. But it's even at that, it's real interesting in how we worry about the environment around alcohol consumption and what's happening in our communities. So yeah. It's really worrisome for me. I always think about when you show the region, I would love to hear New Mexico specific data whenever you get a chance. But if we can put that request in, we'll do that today. We'll send that request now. We would love to.
Yeah, unfortunately, we need a bigger sample to be able to New Mexico specific data. We need to survey more people so that we could do that reliably.
Sure.
We only had so many resources at our disposal. I see a lot of chat and I have not been able to keep up with it. Well, listening to
I can read one. Jesse asks, is there any data about age groups and changes in drinking habits?
Yeah, we did our analysis by age group as well, and there was no significance. I'm sure you can always see changes, but there were no significant changes in age groups from February to April.
We saw an increase, but no group greatly increased more than any other group, right?
Right, and let's not forget that we could only survey adults, which there's another group of interest will be adults, will be children because of a lot of home delivery that is happening and not checking IDs and so on.
Yeah.
And also another group that will have been interest looking at will be pregnant women.
There's another question that says, how did you control for the very important historical factors that influence alcohol use? And then they give an example. The number of school-aged children in the home and increased stress required by home-based schooling for parents. The pressure cooker impact for high COVID-19 rates in people of color, many of whom were essential workers and had no choice but put themselves in harm's way, and yet meanwhile had school-aged children in the home.
Right, and that's why we did the stratified analysis. I mean, it's kind of a way of controlling, the general models controlled for the demographics, but then for all the demographics, and then we also looking at the stratified results that the model produces. We can see those increases. We have information on the number of kids at home actually, and whether they're school age or not. But we know we can the data. We don't have huge amount of observations.
I mean, I think there's only so much you can do with data, right? You go out, you ask some questions, and I think it really begs the question, well, why are we finding this? Why are we finding some groups have these huge increases? Average drinks per day, 4 times higher in households with kids, than households without. Well, I don't know if you heard the piano in the background. I know there's stress in households with kids, but I think part of what's behind that question is probably, well, why is this? And one thing that researchers always like to finish their papers with is further research is needed. And I really think further research is needed. Can we replicate these results, and can we dig in and find out why there's differences? And I saw another question about, are we planning to redo the survey? So this survey was funded by my boss or my boss's boss, who we came to her with an idea, and she said, yeah, do it. RTI is going to fund it. But, we're just a little private nonprofit, 5,000 people. But, we don't have really deep pockets. So we are looking for external funding to help us do further waves of the survey. I mean, imagine if you had this survey over time. Imagine if you had it with different waves of the pandemic. You know, I think that would be fascinating to look at as things change over time.
I have a question, and it pertains to something that two of the folks on the chat mentioned. At the state level, we work very closely with Special Investigations Unit, which is our part of our state police. And they have told us that due to the public health order, they had a requirement, like all of us, to wear masks out in public. And consequently, they could not do compliance checks to, of course, check if retailers were selling to minors. And the reason being that with wearing a mask, it would not hold up in court because you couldn't identify who the youth was. So literally, we have not had any of those types of compliance checks for both alcohol and tobacco in our state since the public health order was issued in March. And I wondered, have you seen or heard of that in other states? One would hope there'd be a way to get around such a thing, right? Because obviously law enforcement is a very crucial stick to enforcing the law.
It's very troubling. I don't know what the solution is. I wish there was one.
Have you heard other states say anything like this?
No, this is so it's, you know, this is still fairly fresh off the shelf. So I have not, and I've looked for it actually, and I've not seen much out there. This is really interesting. And this is one of the reasons I value this kind of interaction is to, you know, many of you have connections on the ground and with the folks who are really trying to make this stuff happen. So I appreciate that.
Well, we definitely appreciate this presentation and your willingness to come and talk to us about it. We felt it was really important because obviously one of the main issues we work with is alcohol prevention across the lifespan. So we really appreciate this information and would love to hear it again if you do the survey again or if you're able to get more data about New Mexico quite specifically.
Thank you for being very gracious, guys, and thank you for your engagement and interest.
And I did want to mention to someone who did ask if the presentation would be made available, I believe we can do that. So as we'd mentioned previously, all of the presentations will be available on the New Mexico Prevention website. So I want to just remind you that it'll be up there probably within a day or two or three. There's also going to be a recording of the meeting that will be available later, and it'll be available via email and as well as the website. Just a reminder for you folks who are doing SINAR merchant education training tomorrow morning. It starts at 8 with our very own Jay Quintana. And then of course the other grant specific meetings also happen on days 2 and 3, and you should see that information on the agendas that you received. The Zoom information was sent out previously to you for those links to those specific meetings. If you didn't receive it or you have any questions, please contact a member of the OSAP team or Andrea at Coop Consulting. So